Hi, my name is Maria Chaudhry. I'm a midwife and herbalist, and welcome to Apothecary Wisdom. Today we're talking and spending time with fevers, understanding fevers, how they affect our body, how they're our friends, how they are creating homeostasis in our body. We are exploring how to treat fevers with herbs and with hydrotherapy, and so all those videos are in the playlist for you to download and look at and listen to. This is the last segment of the fever series, and we want to talk about when is it appropriate to seek medical care? When is it appropriate to get a second opinion? The statement goes, if in doubt, check it out. There is no harm, there's no foul in going to the doctor and getting information about the situation. There are some people that will run to the doctor at the drop of a hat for every little thing, and there's other people that will let something grow and let something build until it becomes a big, more serious problem. And so you can just let that land wherever it lands with you. There are times in our lives when we have to make these medical decisions, and we have to make decisions for ourselves, and we have to make decisions for our children, and sometimes we don't really feel equipped, right? We need to learn to cultivate and trust our inner expert, especially if you're a parent. The truth is, parents are the experts of their children. Yes, doctors know a lot of stuff. They went to school, they have resources and data and information, and they know a lot, but they don't know the subtleties of your child. They don't know what's making this symptom unique, different than the other symptom of the other child. And so that's up to you to start to hone in and tune in your ability to observe, your observational skills, especially if you're a parent taking care of a young child. The challenge is they're not able to effectively communicate with you and tell you, oh, I have pain right here. They're not able to tell you exactly what's happening. And so you have to use your observational skills and cultivating. It's truly a cultivation to trust your inner expert. There's no one that expects you to know everything, and there's no one that expects you to just at a drop of the hat have this skill already. It's called a skill because you worked on it a little at a time. That means there's been small situations where you've relied on your instinct and it worked out, and so then it got to be another bigger situation where you relied on your instinct and it worked out. So this is like step by step, baby steps. So there's not a one size fits all, because I don't know where everyone is. Right? We all have different access to medical care. A person living in town that's 5 minutes from the hospital is really different than a person that's living rural in the woods in the winter or down a dirt road. Right? They might need to get somewhere quicker. Right? So I don't have all the details, so I'm not going to give you cut and dry, but I'm going to give you things to think about. Also, another thing I want you to think about is sometimes we get really focused in on one detail. That becomes our deciding factor when I really want us to zoom out and see the whole picture. What I'm talking about in relation to fevers is you see it written all the time. Go to the doctor if the fever is over 102 degrees or 103 degrees for a child. But then so I want to paint this picture. I'm not telling you what to do. I'm just going to paint the picture, and you can decide what's the right choice. Let's just say there is a child, the temperature is 104 degrees. Right? It's higher than 103. But this child is eating pretty well, drinking plenty of fluids. They're able to go to the bathroom. Their urine is dark, but it's not too dark. They don't have any other symptoms. They don't have rashes or any other accompanying thing. And they seem to be sure, they're tired and fussy, but they're not lethargic and they're not delirious, and you're able to wake them up. So there's that person. And then there's this other one where this temperature is 101. It's within range, but this child is listless, is tired, unable to really wake up. This child hasn't really gone to the bathroom, is having an inability to eat and drink. They're becoming really dehydrated. So both of those scenarios are a little out of realm, but one of them seems like they're kind of doing okay, and the other one seems like they're really not doing okay, even though the number says 101. That 101 situation seems to be more severe from my perspective than the 104. So I just want you to think and see the whole picture and look at ancillary things. Are they eating? Are they drinking? Do they have other symptoms? I wrote this ebook. It's a small, quick read ebook, Herbs for Kids. And in there, I talk a lot about how to cultivate your skill to make decisions, your inner expert, and time frames, and clearly written out, delineated things to tell you when exactly to go to the doctor. So I encourage you to download that book and to get the free course. The link is in the description. But I'm going to give you a list right here of things that I think are really important. Okay, so I'm going to just look at my list because I want to make sure I get them all. So first and foremost, if you have a newborn and they're less than 6 weeks old and the temperature is 100.4, you should take that baby to the doctor or take the baby to the doctor. The other thing is if the baby has a bulging fontanelle, take the baby to the doctor. If the child has unable to tuck their chin to their chest, take that child to the doctor. Could be a sign of meningitis. If you're pregnant and it's your first trimester in pregnancy and you have a fever, you should seek care. If this person, whoever it is, doesn't matter the age, has swollen glands and rashes accompanied with the fever, you should get more information about that. If you're having any age, again, urinary symptoms of urinary tract infections, meaning burning, itching, stinging, blood in your urine, backache with a fever, go to the doctor. If you're having concentrated pain in your abdomen, go to the doctor. Along with a fever, go to the doctor. If you're having really watery diarrhea and vomiting and it's lasting over 24 hours and you have a severe headache, go to the doctor. If you or your person is really confused or delirious or having spasms or having febrile seizures, go to the doctor. And if these symptoms of a fever are reoccurring, meaning they go away and they come back and they go away and they come back and they go away and come back, or they're prolonged, they're lasting for days and days and days and days, go to the doctor, because it could be something more serious. And or this whole other thing, and or if whatever you've been doing is not working, go to the doctor. And then I'm also just going to say those are really clear things. But some things are vague, like that first scenario I gave you. And I'm trying to cultivate that you trust yourself and you trust your gut and you just follow that. So what if you go to the doctor and they go there and you go and they say, oh, it's a virus, just let it run its course. There's nothing to do except for go to sleep, watch some YouTube videos about births on botanicals. They'll tell you what to do, right? So yes, you lost work and you paid for that and that was a real bummer, and then you learned something. That's a very different scenario than when you're in a situation and you're like, ooh, I think I should go to the doctor. Well, no, not yet. Oh, I think I should go to the doctor. No. I think I should go to the doctor. No. And then later when something builds and becomes much bigger deal than you want it to be, and then later when you're kicking yourself, like, damn, I knew to go. I didn't listen to myself and I knew to go. That can be dangerous for the health of whoever you're taking care of, but also dangerous to yourself because you want to learn to cultivate, to listen, to trust yourself when you have to make decisions. So, for 2 reasons, go to the doctor. For both reasons, to learn to trust yourself and to take good care of people. Think about going to the doctor. The other thing I want to say, I keep looking at my notes, is because we've been talking a lot about fevers in a lot of videos, is another thing I want to say is when you're taking care of someone, 2 things. You want to write everything down. You want to write down. What I mean by that is when the symptoms started, the date and the time, the day, what symptoms they have, what you gave them, what herbal remedy, what how much ibuprofen, whatever you gave them, write it down, write down the time, the amount, write down the whole story, what their results were. And set time frames. Set realistic time frames, meaning like a fever, sometimes it's in the night. So how are they feeling in the morning? You set, and when you get to that time frame, don't just blow the time frame off. It's the time to stop and look at the time frame and see the symptom picture, see what's going on, see if you need to extend the time frame. Okay, things seem to be working. We can reevaluate again in the evening. Or this doesn't seem to be working, but it's not that bad. Let's change up our protocol a little bit. Or let's go to the doctor. So setting time frames, sticking with them, writing down your story, trusting yourself, getting information and validation is always a good thing. We all need it. We all need it. And as a midwife and as an herbalist and as a mother, I've been in those situations, taking care of myself, taking care of my family, and taking care of other people. And so I'm speaking with real experience. When you have that thing inside you, I don't know, should we? You should always check that out. Always check that out. At the same time, I want to foster trust in your body. Your body is brilliant. Your immune system is powerful. Herbs are incredibly helpful. They know what to do. They know how to do it. You yourself are very capable. And so I don't want you to get swept away in this fear zone. I want you to be placed in the presence of being present in this situation and making wise decisions and utilizing useful tools. I know you can do it. Watch the other videos about fever. If you're watching this anywhere other than our website, I want you to go to our website, birthsongbotanicals.com, because I have an extensive blog all about how to take care of yourself naturally. There are podcasts and videos, tons of products, herbal products to help you with fever and other related issues. And there's a whole playlist about fever. And so, my friends, as always, drink deep and walk in beauty.